No medicine can remove the cause of a lifestyle disease, but you can. Welcome to this fourth and final episode on liver disease and fatty liver. In this episode, we see how clinically supported lifestyle correction can make a very big impact on treating multiple diseases and like liver disease and fatty liver, sometimes all together. We have with us Dr. Jolly, who has extensive experience in treating lifestyle diseases and including liver diseases and fatty liver. The first question to Dr. Jolly is, when we are looking at lifestyle correction, what exactly is the difference between lifestyle correction as practiced by any individual and clinically supported lifestyle correction?
See, lifestyle correction means every individual has an understanding about lifestyle, correct lifestyle. Some may be thinking that their lifestyle is not correct and they'll try to do some exercise and reduce on calorie and all. And some are clearly saying that the person I am meeting actually, that patients itself saying, Doctor, I am doing all these things, but I have this fatty liver, I am very healthy eating, I have a healthy eating habit is there. And but I am diabetic and hypertensive, and I'm taking all this medicine, and now the liver is having grade 2 or grade 3 fatty liver and fibrosis is there. So some people will say, I'm slightly foodie and lazy to do any exercise. So I know the disease, I got the disease because of my problem. So whatever be, if you are doing lifestyle correction with your own limited understanding, each person will be having a different understanding about the food and the life habits and all. If you have a disease, if you think that you are doing all the effort you're taking also, if you are having a lifestyle disease and you are on chronic medication, only for lifestyle disease we are taking chronic medication. If you get a flu, it will be, the medication will be taken only for a week or so and we will come out of it. Or if you get a sprain or any pain, if it is 1 week, it is okay. That is not, we don't count it as a lifestyle disease. But if the disease is recurring, that means if you have to take it medication continuously, that means it is a lifestyle disease. You had your lifestyle correction. If you think that you are doing lifestyle correction, or if you are thinking that you are not doing whatever you are not able to do the corrections properly. That is the meaning of that. If you are not able to come out of the medication and the disease, your lifestyle correction is not going in the correct way. In that place, the importance of the clinically supported lifestyle correction. Clinically supported lifestyle correction means the way I am following. There may be different methods following in different part of the world, in different countries. There will be doctors who may be following this clinical support and lifestyle correction. And but uh, in my clinic, the clinically supported lifestyle correction we are following, in that we follow this study the patient's body and also the blood parameters and also the necessary investigations to understand about the body and also their lifestyle, their food habits, and also the mental and physical activity, also the sleeping pattern, everything we study. Then only we start the treatment as such, and then we follow it with the regular monitoring. The blood sugar and all in 4 times a day, BP also 4 times a day, and depending on the patient's diseases, we follow. And we usually initially every 8th day we come to the this uh, assessment, progress assessment directly also. So within 15 days or 30 days will be patient will be almost everything is not in the perfect because the body needs some time for the repair. So usually as a generally we according to the modern science understanding, almost 90% of the cell will be replaced in 90 days. Only the rest of the 10% will be there to for the correction next year. So within 90 days we get a reasonable correction. So even the blood cells, that is the most number of cells in the body, is the blood cells is the most number wise. So the WBCs will be this 90 days that the immune system cells will be replaced in many times. Usually the immune system cell have many of the immune system cell have only 3-4 days or maximum 1 week lifespan. But the the RBCs, the red blood cells, they have a lifespan of 3 to 4 months. So these blood cells, RBCs also will be replaced in 3 months to 4 months. So that is why the clinically supported lifestyle correction, they follow the patients very closely for the first 90 days and then again for another 90 days, till 180 days. So by the time most of the problems will be there, with the reasonable settlement will be there. But when you are talking about the liver, if the initial first level 1 fatty liver or level 2 fatty liver will be most probably corrected within 180 days itself. But if it is 4 or grade 3 with fibrosis, cirrhosis and all, it will take more time. The reason is the liver cells lifespan is almost 1.5 years. So it will, the multiplication time and also will be changed. So if end stage liver disease and all, the person has to be followed up and given support and all at least for 1 or 2 years actually. But actually, even if talked like that, it is actually we are getting much of harm. The patient will usually even the I remember a patient was advised for the transplant. Also, he is able to manage himself within 3 months itself and with the support. But that is it. And he is advised for another 1 or 2 years also continuous follow up.
Actually, most lifestyle diseases that you treat, maybe many come together in a patient. There will be many numbers of them, but whatever it is, normally when they start, there is no pain associated. It is something like some discomforts and all that, but not pain as such. So when you come across patients who have been under treatment for say diabetes, cholesterol, hypertension, and liver problems and all that, maybe they are having all of this together, but they don't have any pain as such, and they may only be noticing the seriousness of it during some lab tests, etc. By chance they must have come across. So when these patients or which type of patients actually prefer to go for clinically supported lifestyle correction to overcome their issues?
See, usually those who are interested in clinically supported lifestyle correction only will be come to me, because when if they're contacting my staff itself or the reception itself, will give a clear direction about what is clinically supported lifestyle correction. Even it is in the website and all, it is very clearly written. If they're interested and willing only, they'll be usually coming for uh, to me. So if they are coming, we will be doing, and basically they are interested in the lifestyle correction. And usually the patients all know that if it's a liver disease, they know that usually the stage 1 and stage 2 and all will be ignored by the patient because they don't have any pain and they don't know. Usually after a scan or a health checkup, if the patient is seeing stage 2 or stage 1 fatty liver, the patient, if at all the patient, the doctor will not usually want. And I had seen that the patient, the report is there, but they don't know about the significance at all, and they had consulted their physician and all. And only with they may be coming for a fatty liver grade 1, no one comes. They may be having some other problems also. And but some patients, with more health conscious patients, may be thinking about that if they saw a result like a fatty liver 1 or 2, they will come. So there are very health conscious, very well aware of the health, and very yeah, knowledgeable about the health. Maybe they will be having PhD or other things are there, but they may not be. Many will be may not be aware of the importance of fatty liver or what is the significance and all. So if they come, we'll work out and give advice. And usually 90% of the patients will be having so many other problems, especially the core, this metabolic syndrome, other part like diabetes, hypertension, heart disease, everything, and also maybe kidney also started failing. And because of that, they may have some symptoms also. And if the diabetes is there, there will be symptoms like nephropathy, neuropathy, this 4-3 urine. When they pass urine, the bubbles will be, or the frothing will be there. So such symptoms, after they will be worried and they will be coming for that. So whatever the most rewarding or the most satisfying thing as a doctor, if a lifestyle disease or one or many, if the many of the patients will be having obesity, hypertension, heart disease, and along with that fatty liver, they may be having sleep apnea and sleeping with the CPAP, or they will be having arthritis also. There may be this degeneration of the knee replacement also have been said. But all these patients, if they are willing for a lifestyle correction, if you go in the correct way, we can, even this obese patients, we can reduce around 20% of the weight within 3 months itself. So that means within, if the person is 100 kg, within 3 months he can come down to 80. That itself is not in a admission or in this nursing home thing. It's only while the patient is at home itself, they can, this home management. If it is a ideal situation, it is in a clinical setup, if they are staying itself, I am sure that the result will be much higher. We are not providing such a facility now, but with they are continuing working and everything. They can, if the person is healthy and a young person, they are continuing going for the work, and they can do that. That is the situation. And that is the most important thing everyone should understand. If they have a will, they can come out of all the medicines simultaneously. All these medications for the diabetes, hypertension, everything, most of it. With the rare situations, they may have to continue few of the medicines, like those who are on pacemaker or recently put a stent, then they have to take the blood thinners. Otherwise, most of the medications can be come out within a month or two.
Actually, when you are looking back, say 50 years back, people generally, they would avoid medicines as much as possible. So, if there is a need for medicine also, they will take it for 2 days. Then they will say, doctor, can I stop within tomorrow? I'm better or something like that. But nowadays, we find that, the number of medications patients take, especially those with lifestyle diseases, is increasing manifold. So, in such a situation, for you have mentioned earlier about how patients you meet who take 15 to 20 tablets a day. So, what happens when you say that you can reduce and sometimes avoid taking medication, if you do this, if you look at this approach, do they feel shocked, or they are, I mean, what is their general feeling? And also, I'm interested in knowing that, are there people who would like to stop medications in the current world where, medications are seen as so simple and easy solution for all of our problems?
Basically, those who have some knowledge and inclination for or understanding this lifestyle disease, it is not the answer, this medication. They might have, the patients who are coming to me is having such an intelligence level. It is not they don't have to be very high of education and all. They may be just school final or the SSLC or school, basic school education, or even less than that with the, but they're intelligent enough to understand. And most of them are coming after watching this sort of videos, and they feel that it is possible after, or they may be searching for their problem and then say I'm popping up the video or going into the, then they actually come after studying, and then only they are coming. And next to another sort of patients is actually the family members. Usually, this videos, and they are coming after so much of research only they will be usually coming. And then the family members. Actually, I have same family. The one person is getting out of the diabetes and other problems. They will bring the other patient, and their brother or sister or husband, and they're saying that the patients actually is the most disappointment for the patient. They are actually finding out it is, and they are experiencing it. But then they say to the friends and family, they are not believing it, or even if the person they got the result, they believe it, but they are not willing for the correction. They just want to go take the medicine, and that is actually the patient itself is so depressed about they are not able to motivate the others for the, even though they believe that they know that he got or she got the result. That is because the lifestyle correction is actually the patient or the people are finding it very difficult. That is not difficult, that you had to come into that understanding. Mainly the people are not understanding the side effects of the medication because it is so freely used. So the side effects, because every doctor will be promoting the patients to take the medication regularly. So it is true also, because if you take antihypertensive or medication with a regular interval, it can shoot up the blood pressure. Even there can be a rebound shooting up of the blood BP and give a hemorrhagic stroke. So even one dose of diabetic medicine or the insulin injection is not taken, the blood sugar will go shooting up. So that is the situation. If the painkillers, if you are not taken at one single day, that after it will be having maximum or 8 or 12 or maximum 24 hours, any medicine, usually. So if the time period is over, you will get the symptoms back. So actually, it's only 100 years we are, this modern medicine is, this pharmaceutical medicine is in the increase. That is, I think in the 1925 it started. This hike in the medication and the pharmaceutical discoveries and all. So, but the last 50 years, during the last 50 years, we understand that so much of medicines is there, but none of these lifestyle diseases is getting corrected. And actually, it is going further and further, and the liver is getting damaged. If a diabetic patient or the hypertensive patient, liver getting damaged, kidney getting damaged, and it is a progressive problem. So actually, I'm in the medical profession for the last 40 plus years. And I am also saying that I understood that it is not a solution for, there is none of the this diseases. Actually, the medications, 90% of the medication is taken for this lifestyle disease. How can a lifestyle disease be corrected without correcting the lifestyle? So if you are taking the medication, it is very difficult, especially the diabetic medications you are taking, it is very difficult to control your diet itself. Because if you are taking hypoglycemic medicine like insulin and skipping food, you will get a hypoglycemia and all sort of discomforts. So the person will be eating more. So that is the reason for the progress. So the people has to understand that. So we are going in the wrong direction in the healthcare. I felt like that. That is the reason for this developing a protocol for lifestyle correction, and like that is working. It is very clearly and it is evidence based, because we are doing all the tests, and it's much more meticulously, not in the like the modern medicine, which is when the medicine is used, we are using actually much more meticulous follow up also.
You always say that the patient who gets into this clinically supported lifestyle correction format for treating lifestyle diseases, they change over from being a passive patient to becoming an active patient, and then only that improvement starts. How do you see that many patients, for that matter, almost most patients, they like to remain passive. Means they are just normally they are told you should watch your weight, or you should watch your BP, or you should watch your liver health. So they prefer to keep watching and let the others do what is needed. So you are saying that such patients who are willing to just keep watching are not suited for this. They have to be more active. They have to take initiative and all that. So if it is like that, do you see any particular traits in these patients that who choose this format? In the way they approach treatment itself.
See, the patients who is having basic understanding of the health and also having a reasonable intelligence. It is not the education. It's whether they are actually the the doctors or medical professionals, not immaterial. And those who have a basic, they should be able to understand that too. They should themselves ask questions like, I'm taking all this medicine for this many years, but I am not getting any, my disease is not getting corrected. Why? The person itself should ask. And they know, they should understand that now, previously, when 40 years back, we were not understanding that this diabetes is a lifestyle disease, or the hypertension is we were not knowing what is the reason. So we were in darkness actually. But now we are very clearly, even WHO's list of lifestyle diseases, all these diseases are there. Then how can a lifestyle disease be cured or reversed or corrected by medication? That is, so last 50 years or 100 years of experience in the modern medicine itself is showing this very clearly. But a person who's able to ask such questions and find out the answer only will be suited for this. And also the understanding about what is the correct body weight, that is also very important. The people has a very wrong impression that everyone is thinking that the BMI 25, that is the upper normal, is the normal. Actually it is not like that, because our lifestyle is sedentary lifestyle. In the sedentary lifestyle, the low normal BMI should be the it should be kept, especially if you have a disease. So such understanding they had to develop by themselves. Then only they will be suited for this lifestyle correction. And there are some patients coming and asking, Doctor, I don't want to make any change in the lifestyle food habits. I want to take all the thing. I am not interested to, or someone will say that I am not interested to do any exercise. Actually, in this pattern of exercise, there is even those who are having this arthritis and all, they can do. They can. What we are teaching them is the thing which can be lying down in the bed, and also the sitting or lying down in the just all everything can be. They don't have to even walk also, because those who are having any problem also can do this. So if they don't want not willing for any exercise and not making any correction in the lifestyle, they're not fit at all. That, well, frankly speaking, then cannot be done anything. You had to do, then only you will get the result. So that is it. If the person who's having some intelligence should be there, they'll be asking self questions: why I am not getting it corrected? What is the reason? And willing for the correction.
The patient, or at least the patient's support person, should be able to understand exactly how and why he got that disorder or disease.
Yes. Basically, the understanding, as you said, the understanding of the family members also is very important. The patient may be getting a very good idea after seeing all the videos and searching the web and everything. But the family members, if the 70-year-old father want to do the correction, their advice for a bypass or a major surgery, but the children will not allow, because they are not learned. He may be saying understanding it, studying it for a long time. Then only the person will be understanding. And but the other family members, they don't know anything about it, and they will object. And also in the reverse also, the child, the son or daughter will be learning about it and trying to understand the parents. But the other family members and the parents may be overaged, and they may not be having that much of the cognitive power, and they will not be able to understand. But the other siblings, which are, they are not aware of it, they will seek the clear road, that is the common pathway, like going for the other modern, maybe taking, continuing with the medication. So that is the difficulty. So I think that awareness, when the people will start understanding it, and the awareness will be increased, and then the problems can be solved.
That people come from faraway places also for this treatment, clinically supported lifestyle correction. But what happens if a patient having liver problems and associated issues, they are from a distance? How do they actually get them the benefits?
See, I can tell you an example of a person who is in the middle of India, actually. It's in the northern state, actually. Now we are in the Kochi, I'm practicing, is in the southern part of India. It is miles away in the, I think, in the Andhra or that area, actually. He was actually advised to have a liver transplant. And he was booked for in a hospital at, I think, in the Hyderabad or some hospital. He has been given a booking for the liver transplant. And the hospital was asking, actually, after, in between, he came and he had tried some Ayurveda and also, and he came into Kerala. Basically, he's a Keralite also. He has some connection with Kerala. So he came to Kochi, and anyway, he's posted for a liver transplant. But what I saw is he's healthy, and he's able to travel from this Hyderabad or Andhra Pradesh. He's able to travel by himself, and he looks okay. He's not decompensated liver disease patient. And we did a detailed analysis on his liver enzymes, and many of these autoimmune antibodies also said actually his problem is autoimmune liver disease. And now I think he's almost a year. And on the 15th day, again, after starting at 8th day, 15th day, 30th day, they'll come. And in the 15th day, he again asked me, Doctor, the hospital people has called for the donor is ready. Are you coming? So I told him that you can decide whether, because the liver transplant is a major surgery, even it is successful, because the liver kidney transplant is comparatively a minor surgery. Comparative, the transplant surgery. Even cornea is the most easiest. The kidney is okay. In the liver, you have to remove the liver and putting a new one. And the liver is having so many enzymes and so many proteins are expressed. So the rejection possibility will be very high. And also the donor also will be having, if the relatives is the donor is also having a very high risk compared to the kidney problem, kidney transplant, kidney donation. So we had to understand that. So now he's now having no problem, but after the operation, what will be his situation? We cannot, whether it is, if it is rejected, it is the end of the life, if the rejection, or even if it is successful also, immediate success is also, the rejection, delayed rejection can come. And also the patient has to take a very heavy dose of immunosuppressants all through the life, and it can give him the chance of life expectancy can be reduced because of that steroids and this anti-inflammatory immunosuppressive agents like weight gain, diabetes, getting all these diseases because of these side effects. And also this medication itself can fail the transplanted liver also, because this is also has to be managed by the liver. So this person actually, he understood it, and he didn't go for the surgery transplant. Now he's almost a year. He's healthy and he's managing. It's very well. And that is the thing. Even those, if the patient is having clinically stable patients with renal liver failure, advice for a liver transplant also can come out of it. And it's usually from, even I get patients from the other countries, so in other continents like USA. There are so many Malayalis in the USA, basically Indian origin people mainly coming, and because they have a base here, they're even within a month they can, almost all the patients we ask for, if they are coming abroad within India, they can come and go. It's not a problem. But if it is distant, it's always better, because to stay here 1 month and settle things up, and then you can go and follow up over the telemedicine, and come down once in a while, according to the patient's sickness base and or the condition. They may have to come for the follow up also, or we can do the telemedicine follow up.
Now we have got a good picture on liver diseases and where the responsibility lies as far as the patient and the patient's caregivers are concerned about treatment and what they should know about liver health and what damages the liver and what supports the liver. And most importantly, the importance of all the other comorbidities and other diseases and their interaction with liver health, so that the treatment can be done in the most optimized way. With this, we come to the end of the last episode of our series on chronic liver disease and fatty liver. Thank you. The informed patient is key to treatment success.